Let's see an NCLEX RN video based on care for patients with lower airway disorders. Lower airway disorders impact the oxygenation, ventilation and gas exchange, thus affecting tissue perfusion. Some of the common lower airway disorders are asthma, chronic obstructive pulmonary disease (COPD), cystic fibrosis and lung cancer. Let's go through the video. The first question, the nurse assesses 3 asthmatic patients who present to the emergency department with the following symptoms. Which patient should the nurse treat first? The patient with an oxygen saturation of 91%, the patient with a peak flow less than personal best, the patient with inspiratory and expiratory wheezes, the patient able to speak in short sentence. So you need to know what is asthma. Asthma is a chronic lung disease characterized by an intermittent reversible airway obstruction resulting from the inflammation of the lungs airways and the tightening of the muscles that surround the airways. The condition affects the bronchial airways and not the alveoli. When the patient is exposed to triggers or risk factors, the patient exhibits clinical manifestations such as wheezing, dyspnea, coughing, increased sputum, increased respiratory rate, experience chest tightness, tachycardia, and a classic sign of asthma attack is inability to speak in full sentence. So here, the patient with inspiratory and expiratory wheezes, that is the patient who need to have immediate attention by the nurse. All the others are also symptoms of the respiratory compromise in asthma, but patient with this inspiratory and expiratory wheeze is demonstrating a severe exacerbation of asthma and needs immediate treatment. A patient with COPD is given a high dose of oxygen in response to a low SpO2. What is the priority intervention for this patient? Cardiovascular assessment, assessment of the respiratory rate, medication administration, respiratory therapy referral. All these things are important for COPD patients. But priority intervention for COPD patient receiving high level of oxygen is the respiratory rate. The respiratory rate will decrease due to the fact that his breathing is stimulated by a decrease in oxygen level. When we are administering more oxygen, the patient has lost his stimulus to breathe. You need to know that the respiratory effort in a patient with COPD is triggered by the decrease in oxygen. It is not by an increase in carbon dioxide. When we are administering oxygen, at that time the patient will reduce his breathing response. So we need to assess the respiratory rate and SpO2 when we are monitoring the patient. Effective management of the asthmatic patient requires which of the following? Pulmonary rehabilitation and anti-inflammatories, regular assessment and control of environmental factors, short-acting bronchodilators and stress reduction, weight control and regular assessment. For a patient with asthma, medication management is essential, but we need to regularly assess and control the environmental factors so that the asthma attacks will not come often. The first one, pulmonary rehabilitation, stress reduction, weight control. They are not all components of the management of asthmatic patients. We can give anti-inflammatories, we can give short-acting bronchodilators, and regular assessment is required, but pulmonary rehabilitation, the stress reduction and weight control is not needed for the management of asthmatic patient. What is the predominant diagnostic test for lower airway disorders? ABG, chest X-ray, pulmonary function test, oxygen saturation. Here the question is diagnostic test for lower airway disorders. Pulmonary function test that assess the airway movement. That is the diagnostic test for lower airway disorders. ABG and oxygen saturation, they are not diagnostic tests. They are helping in just assessment only. And the chest X-ray identifies the pulmonary lesions or consolidations. What is a priority nursing diagnosis for a patient with lung cancer? Impaired nutrition, pain control, impaired mobility, risk for infection. So for a patient with lung cancer, pain control is the priority. They need to see the other things also. We need to see for the nutritional status, their mobility and risk for infection, but the priority is pain control. A patient with asthma presents with which symptoms? Cough, elevated BP, decreased respirations and fatigue, increased respiration wheezes, increased sputum and decreased respiration. So an asthma patient will show increased respiration and wheezes. Cough is present but there won't be elevated blood pressure. The respirations are increased, it is not decreased. Fatigue will be present and sputum production also will be increased, but the respirations are always increased and the wheezing sound will be present. What is the primary difference between emphysema and chronic bronchitis? Chronic bronchitis predominantly affects the large airways. Emphysema predominantly affects the large airways. Emphysema predominantly affects the alveoli. Chronic bronchitis predominantly affects the alveoli. So, this chronic obstructive pulmonary disease COPD is composed of two diseases. One is emphysema and the other one is chronic bronchitis. There is some difference between this emphysema and chronic bronchitis. Emphysema is a disease caused by the destruction of the alveoli. Alveoli is affected in emphysema and airways are affected in the chronic bronchitis, and especially small airways are affected in chronic bronchitis. So here the answer is emphysema predominantly affects the alveoli. All others it is written chronic bronchitis. It is affecting small airways, not the larger ones. Emphysema is not affecting the airways, it is affecting the alveoli, and chronic bronchitis also it is not affecting the alveoli, it is affecting the small airways. In this alveoli are affected in emphysema due to air trapping and premature closing of the airways in emphysema. In chronic bronchitis, the smaller airways are affected because of the increased production of the mucus. The walls of the bronchus thickens and causes the airway obstruction. What is the priority treatment for a patient with cystic fibrosis? Nutritional counseling, airway clearance, medication administration, patient. So cystic fibrosis is a genetic disorder and it is a multi-system disease that produces increased amount of thick mucus in the respiratory system, gastrointestinal system and the reproductive system. The disease is characterized by thick viscous mucus that clogs the lungs and obstruct the pancreas. The other organs affected are the liver, salivary glands and testes also. The mucus buildup in the gastrointestinal system and pancreas lead to an exocrine insufficiency, blocking the transport of pancreatic enzymes and resulting in reduced breakdown and absorption of food. That happens in the gastrointestinal system. And in the lungs, because of the increase in thick sticky mucus production in the lungs. It leads to mucus plugging of the airways, and inflammation happens, and bronchiectasis, that is the chronic dilation of the bronchioles, will happen. So that is what happens with the lungs, and the pulmonary diseases will result as a result of cystic fibrosis, which lead to mortality. And the reproductive problems mainly happens with the males, because the thick mucus production result in plugging and deterioration of the vas deferens before the birth, and this vas deferens transmits sperm from the testis. So there is a problem with the sterility also. Thus, here the priority treatment for the patient with cystic fibrosis is airway clearance, as it affects the lungs. Nutritional counseling is required, medication administration is required, and patient education is required for the patient with cystic fibrosis, but the priority is airway clearance. When should palliative care be initiated for patients diagnosed with lung cancer? Upon diagnosis, after chemotherapy, after surgery, upon patient request. Actually, the lung cancer, it has got a poor prognosis, and it needs palliative care from the initial time itself of the diagnosis, as it is a life-threatening illness. So upon diagnosis, you need to provide the palliative care. The nursing care plan for a patient diagnosed with lung cancer includes which of the following? Select all that apply. Education about the disease management, frequent assessment of pain levels, reminders that recovery is coming soon, frequent assessment of oxygenation, weaning from oxygen because the disease is terminal. So the patient is diagnosed with lung cancer. We need to educate about the disease management. Next, we need to assess for the pain level, and we need to give medications. We need to frequently assess for oxygenation also. Maintain the SpO2 above 90%. False reassurance should not be provided to the patient. Let's see a case scenario. Dave, a 39-year-old male with a history of asthma, presents to the emergency department with shortness of breath and inability to carry on a conversation. He is assuming a tripod position and pursed lip breathing. He has a non-productive cough. He woke up coughing followed by chest tightness. His vital signs are BP 120/165 mmHg, pulse 150 beats per minute, respiratory rate 40. He has audible wheezes bilaterally. He has been a 1 pack per day smoker for 15 years. His medications include Hycodan cough elixir, Sirtec, Adavir inhalation, Pulmicort Flexhaler, Tesalon Perles, and Ventolin. Ventolin puffs. SpO2 reading upon arrival in the emergency department is 88%. He started on nasal oxygen, which improves his saturation up to 96%. He remains short of breath and tachycardia with a heart rate of 135 beats per minute. He continues to be short of breath and to wheeze. His SpO2 remains acceptable while he receives oxygen via the nasal cannula. After the first 3 nebulizer treatments, his peak flow reading is repeated. It is slightly improved but not back to baseline. Then he receives prednisolone 60 mg IM. The symptoms slowly begin to subside. Repeat of the peak flow reading reveals continued improvement. When symptoms are fully resolved, he is discharged from the emergency department with a prescription for an oral prednisone taper. What is the most important component of the medical management of Mr. Dave? Breathing exercise, disease management through education, use of rescue medication, use of a peak flow meter. So here, the self-management is very much required in asthma patients. It's a chronic condition. Once a patient is identifying the risk factors, patient will be able to control the attacks of asthma. So disease management through education and compliance with the medications is very much important. All the other three, breathing techniques, use of rescue medications and use of a peak flow meter, that are components of medical management of asthmatic patients. But the most important is the disease management through education. If upon reassessment there are no wheezes and diminished breath sounds, what conclusion can the nurse make? Mr. Dave has resolved his respiratory condition. Dave has responded to the bronchodilator therapy. Dave has a partially obstructed airway. Dave needs another nebulizer treatment. So here the patient has no wheezes and diminished breath sound. It shows patient has a partially obstructed airway and is close to respiratory failure. He is not moving any air through the tracheobronchial tree. This is a medical emergency. So here attention needs to be given. So now the patient is having a partially obstructed airway. When you reassess and finds the patient has no wheezes and diminished breath sounds. What does the nurse recognize as a priority for Mr. Dave when a partially obstructed airway is suspected? Airway management, medication administration, IV line insertion, patient education. So when the patient has gone for a partially obstructed airway, at that time it is a medical emergency. It indicates respiratory failure. The patient may require a mechanical ventilation, intubation, or advanced airway as the priority. So airway management is the priority. IV medications and the medication administration and patient education, everything is required, but later on. What is the major component of the treatment program for Mr. Dave? A smoking cessation program, a physical exercise program, genetic counseling, dietary counseling. So here the patient was a smoker for the last 15 years. Smoking is a primary risk factor for developing lower airway disorders such as COPD and asthma. Exercise and diet, they are important. Genetic counseling, it is not a part of our treatment program for this lower airway disorders, especially COPD and asthma. So here smoking cessation is a major component of the treatment program. Which statement about Mr. Dave's medications indicate the need for further teaching? I use my albuterol when I am having difficulty breathing. I wait 5 minutes between my inhalation puffs. I'll be able to discontinue all of my medication when my asthma is under control. I should not suddenly stop taking the prednisone. Asthma and COPD, they are chronic conditions. So we cannot discontinue the medications. So this is a wrong statement which is told by Mr. Dave. The first one, the albuterol, that needs to be taken when the patient is having difficulty breathing. So that is a acute respiratory distress medication. The albuterol puffs, they are indicated in acute respiratory distress. Waiting 5 minutes between the puffs, that is recommended, and suddenly stopping a steroid may precipitate acute adrenal insufficiency. So they should not stop taking the prednisolone all of a sudden. Hope you understood the video on lower airway disorders. Thank you so much.